Hi friends, today we have a very interesting person with us, Dr. Chidambaranathan. He's a homeopathic consultant who has a 27 years experience in Madurai, and he practices in Chennai also. He comes twice to Chennai and consults his patients. Today, everybody are suffering from the COVID-related issues, and we are all having a lot of fears. Even doctors, we don't have allopathic doctors. We don't have a much answer for the COVID-related things. Uh, Lot of specialties are there like homeopathy, allopathy, naturopathy, yoga related things. Every one specialty has something good about their specialty, especially for the chronic and viral ailments. The homeopathy has a promising results. Even I have seen in few of my patients, and even I got treated for a few of the viral illnesses like a viral warts, and it gives a fantastic results which our allopathy failed to give. So what we are coming here is for the COVID. What is the what is the medicines available for homeopathy? How is it responding? And what is the principle of homeopathy? How it is originated in the world? And all those things will be handled by our Dr. Chidambaranathan. He's from Madurai. He's going to give us the complete details about the COVID-related issues and homeopathy. Welcome, sir.
Regarding COVID-19, there are a lot of fear this pandemic crisis. Actually, for all viral infection, homeopathy will do very well. That is from starting from very common cold, viral warts, viral hepatitis, herpes, Japanese encephalitis, and there are quite a lot of for viral infections without any side effects. That is post-viral arthritis, post-herpetic neuralgia, for all types of neuralgias, homeopathy will do very well. Like regarding COVID, here, even though comparing to other countries, even though in India its virulence is somewhat low, the fear of pandemic often running, pushing us to the edge. So, Indian government have prescribed arsenicum album 30 to take everyone by early morning for 3 days to boost our immunity level. Usually, homeopathy works with our immune forces, not just against the bactericide or fungicide or viral killer. It usually supports our immune system and makes us more tolerance towards the communicable diseases. That is, the birth of homeopathy itself starting from malaria. It is Dr. Christian Frederick Samuel Hahnemann, who is an allopathy practitioner, abandoned the practice because by that time he could not treat all the cases completely because the complaints keeps on recurring. By that time, during the epidemic of malaria, he just gone through Kalan Metria Medica while translation. He reads that there is a word phrase Cinchona bark produces malaria-like symptoms. That spark ignited his invention. That is, the Cinchona bark is not curing the malaria, not because of the stringent action, but it is producing malaria-like symptoms. So, by the way, he founded homeopathy, which means similar sufferings. That is, its principle is let's likes be treated by likes. Here, Indian government, after analyzing lot of cases from the epidemic, they gathered all the symptoms and matched all the symptoms to the drug and found that arsenicum album will work well for the COVID-19, and also it can help to prevent the COVID-19 by boosting the immunity level. Usually, homeopathy works with the immune system. Uh, If anyone happen to suffer with viral infections or bacterial infections recurrently, if they happen to take homeopathy medicine, surely they can get rid of their complaints once for all. Because it is not just killing the bacteria or virus by that time alone. It works with boosting our immunity level and outweigh all the risk factors and outthrow the disease once for all. So we are not getting the disease again and again. Regarding viral infections, all the viral general medicine will be, that is for jaundice or any CMV virus, cytomegalovirus, recurrent abortion like that. The medications will be providing a lot of side effects. But while taking in homeopathy, there won't be any side effects also, and the cure will be perfect. Even for the viral warts, we are not giving medication externally. We are giving medicine internally. The body itself will shed all the viral warts, and there won't be any new warts. But if you happen to go for cauterization or acid, it will keep on recurring. But with the internal treatment, there won't be any recurrences. In COVID-19, even though many of the homeopathy people prescribe according to their experiences, the Central Council of Homeopathy Research prescribed Arsenicum album 30, which can easily prevent the spread of the infections.
So the Arsenica album 30 is the prophylaxis drug. We have to take 3 days, the 4 pills, empty stomach in the morning for 3 days.
Yes.
Okay. When what will be the treatment when the patient developed the symptoms? He contracted the disease and patient developed the symptoms. Then what is the treatment?
It depends upon the symptom presentation of the complaint, because each patient will present with different symptoms. Even for a jaundice, some will have vomiting, some will have loose motion. Likewise, in COVID-19 patients also, some will have sore throats, some will have cough, some will have fever with throat pain and body pain. Depending upon the symptom, we need to treat. For actually, even though I am in Madurai, there are quite few cases only in here comparing to Chennai or Mumbai. Even though I have treated few of cases from Mumbai and few of cases from Chennai, depending upon that experiences, Arsenicum album and Eupatorium Onnam respond very well for the fever and cold cough cases. But for sore throat, Hepasol 200 works well. But it all depends upon the patient complaints. Patients should not take themselves as prescribed. They need to get analyzed with the proper physician and take the proper medication. So that is the main thing is there are quite a lot of medication for the COVID-19.
What I understood from your
respiratory tract infection and the pneumonia at the earliest, so that we can able to come out of the disease at the earliest.
So what I understood from your what we discussed. So the prophylaxis even you can take without going to a homeopathy doctor, because it's all over. Because now the crowd is so much, we can't, even the doctors in homeopathy doctors can't handle it. So the prophylaxis, you can take the medicines, the Arsenicum album 30 for 3 days in empty stomach, for 4 pills every morning. Once the symptom develop, better to meet the homeopathy doctor or call the homeopathy doctor and find out what are the symptoms. So according to the symptoms, you alter the drugs and give some extra set of drugs, so that along with the Arsenicum album, these drugs also help. Correct, sir?
Sure, sure.
Yeah. So perfect. So one more major question in my mind is,
Kerala have distributed a lot of Arsenicum album. Likewise, in Gujarat, they have distributed a lot of quarantine Arsenicum album to the quarantine people. They have not turned to positive. Very effective, and also I can show one just a piece here. Kerala. This is in the Gulf News. which shows Kerala government distribute the homeopathic medicine to boost immunity. Likewise, this is for Gujarat, 1,063 quarantine individuals succeed for not getting infected through use of homeopathy and Ayurveda. Likewise, other countries, Cuba promotes homeopathy as a weapon, effective weapon against coronavirus. There are a lot of cases. Likewise, this is the Central Council Research for Homeopathy. They have developed arsenic album medicine with the proper research, with the analyzing variety of cases all over the India and prescribed arsenic album. And another interesting fact is, this is a Facebook of Jaswant Patel sir. He is also an allopathic practitioner. We can see allopathic turned homeopathy, MBBS, MD, chest. He is having BHMS with 30 years experience. He had treated cases of COVID and given interview in patients. People can get confident with that. Within 4 days, he is getting people tested negative. One can visit this his page and get clarified.
Yeah, so
Hello,
lot of people started practicing, especially Gujarat and Kerala. They started doing it, and the same way, one of the allopathy doctor, just physician, he interestingly become a homeopathy doctor, and now he was treating for almost 80,000 patients. So I have one more big doubt, sir. So we all so much tuned to the allopathy system, whether we can combine allopathy medicine and homeopathy medicine together in these COVID situations, and is it have any cross reactions or something?
No, not at all any cross reactions, sir. Actually, the integrative approach, multidisciplinary research is promoting from all India level and worldwide. If you happen to go with multidisciplinary and integrative approach, the result will be very pleasing, and patient will be at the most comfort. We should give importance to the comfort first and cure next.
I know.
Because the patient suffering can be curtailed at the earliest, and the initial period itself. We need not to stick on to the one system alone. That is, we can combine allopathy and homeopathy, and we can combine Ayurveda and homeopathy, likewise Siddha and homeopathy. Main thing is, everyone should know their advantages and know their limitations, so that they can refer their people to take the other medication which is having more advantage than there. They should be more broad-minded to help their patient to get rid of the disease at the earliest.
Correct.
For the immune response, the autoimmune disorders and chemotherapy patients, where the immunocompromised patient, where the immune level is somewhat very low, for them homeopathy will also do their at its best. It can improve their immunity level to resist the recurrent complaints.
Right.
So for the chemotherapy patients or autoimmune disorders, they need not to keep on suffering with the painkillers or any other recurrent complaints for the recurrent suffering. They can add homeopathy along with their medication and get rid of the disease, and can be more comfortable with the living. They can easily return to their work also.
So the chemotherapy, that cancer-induced immune suppression, and as well as the autoimmune diseases, there is a lot of good options in homeopathy. That's what I come to know through you, sir. There is no cross reaction between allopathic drug and the homeopathic drug. So you can boldly use the homeopathic drug when you're on allopathic drug. And same as you said, each specialty has some very, very big advantages, like viral diseases will respond in the homeopathy medicine, and emergencies and accident and other things which other homeopathy or the Chitta, that one can't help. So obviously each specialty has some limitations. So doctors, all the specialty doctors like homeopathy, allopathy, naturopathy, everybody have to understand their the plus points and minus points in their specialty. And the end of the day, patient is a prime important person. So we have to help
Yes.
in all the possible ways in a integrated combined approach. So COVID has opened up a lot of people's, a lot of doctors' eye now, because everybody feel their specialty is big. Now integrated approach has to come to help the community
Yeah.
as a wide. So thank you very much for the wonderful session, sir. And we hope we are all fighting against COVID. We will win the disease soon. And this integrated approach will go all over the world and reach a lot of people. And a lot of studies has to be conducted in this area also. And we'll do our best.
Okay.
Thanks for the wonderful interview, sir. Thank you, sir.
Thank you, sir. Okay.